Hi parents. Today we're going to talk about ear infections. Not only acute ear infections, but even chronic ear infections. So I want you to know that I'm going to discuss some theories in medicine that are incredibly outdated, extremely frustrating to every other practitioner except for medical practitioners. And if you've seen any of my videos, you've probably known that I'm actually quite a medical advocate. I believe what medicine has done for society is exceptional. On this subject, though, I might come across a little grumpy, so just give me a little grace on this. The medical theory of chronic ear infections kind of rests in the theory that you're inappropriately made. That as an infant, your eustachian tubes are possibly too short, or maybe they're horizontal. And in reality, gravity has little or nothing to do with your eustachian tubes draining. So that theory gets basically a very, very big red line that these short horizontal and eustachian tubes, horizontal and short, might be the cause of chronic infection. Now, if we take another approach to the cause of ear infections, we might look at the natural approach. And in that approach, I kind of gave it a half right, maybe. And it has to do with the fact of inflammation. So maybe our children have sensitivity, allergies, food toxicities, environmental toxicities. Super valid. And in reality, the chiropractic profession has always been a strong advocate of the natural approach, especially with nutrition and emotional health care. So they really, really are on the right track with that. But really, and this knowledge is not new. This is 30, 40 plus years old. None of this is brand new. It has everything to do with the fact that your child has poor plumbing. And it's not that the right plumbing is in there, it's just not working like it's supposed to do. If you think about it, we're gonna get stuff in our ears, we're gonna get toxins in our body, we're gonna get sinus congestions, even an infant. So what does the body have to do to keep up with this? Well, it has to drain, it has to move the stuff away. There's these little teeny hairs in our ear, they're called villi, and they actually move like a wave, if you will, or like a caterpillar's feet. And they move debris out of your ear. It's fascinating, super small little hairs, and they get stuff out, so they move things out. The eustachian tube will certainly fill up with fluids. And then if you have a pressure gradient between the inner ear and the outer ear on the inside of your mouth, or sinuses, then that also causes the difficulty in movement, in plumbing. But let me tell you the real trick to this. Let me tell you how God made us, because when you get right down to it, we are wonderfully made. We have no limitations in how we are put together. It's really only the environment that we're in and how we choose to live in it that causes these challenges. I remember most of the time I've told you guys that DC stands for Doctor of Chiropractic, but we lovingly say it's Doctor of Cause. So, the neuroscience approach to chronic ear infections, and I want you to don't worry about it, it's not getting too nerdy, but it's going to kind of hopefully be simple. You're going to get the reason, is that there can be neuromuscular misalignment. Misalignment causes fixation. Fixation then causes the nerve to not function well. That whole thing causes poor plumbing. And then the ear or the eustachian tube cannot drain well. So let's go into a little anatomy so I can get you connected to how this works. Now, you have an ear and you have an ear, outer ear, then you have an eardrum, of course. Other side of that is your eustachian tube, which drains into your sinus cavity. Remember, we talked about the problem with chronic ear infections or even acute ear infections is the eustachian tube is not draining well. So there's a trick in there. Well, maybe it's not a trick, it's basically God's creation in there. And we love to call it the TVP. It's kind of a fun word to say. It's a tensor villi palatini muscle. Obviously that's Latin or Greek or something like that. It kind of sounds Italian. But anyway, it's just a small muscle that is wrapping near and around the eustachian tube. That muscle will literally contract and relax, massage in the eustachian tube to push the fluids out of the eustachian tube, drain into your sinus cavity. Well, what controls that? Well, like every single muscle in our body, your nerves control muscle contraction. Now, keep in mind that we have a lot of muscles. Some are voluntary that we can control ourselves, but the majority are involuntary. So we don't control them. It's like your heart muscle or digestive muscles of the colon. We don't control that. Your body controls that based on stimulus it's receiving from the body and then perceiving the best reaction, doing the work it needs to do, and voila, you're healed and happy and healthy again. So the neurology for the tensor veli patini comes from the upper neck, primarily the C2 nerve root, and that's really, really high up in the neck. So if we have neuromuscular misalignment or fixation, which we have a word that kind of puts this whole thing together, not only fixation but neurological stress, and that's basically subluxation. So when we have a physical misalignment of the upper neck, which is easily brought on through birth, technically it's going to happen, if not 100%, 99.9% of the time it's going to happen to our newborn babies. It kind of depends on severity, of course, but it's going to always happen. That can cause that nerve to function inappropriately. And then the TVP doesn't really do its work as well as it can. Fluids build up, poof, ear infection. So it's not really, like we talked in the natural theory, primarily connected to the causes of inflammation like food or toxins and allergies, but it is definitely connected to inflammation, but that's mostly through what's called the vagus nerve. You've heard of the vagus nerve before. It's a cranial nerve exiting that same area as the C1, C2 area, and that nerve is incredibly connected to inflammatory response. So also when that nerve gets stressed, the inflammation cascade gets really out of whack, if you will, doesn't work as well as it should. And then yes, any even slightly sensitive food or slightly toxin can get overboard, causing a reactions. And since your nervous system ultimately regulates everything that your body does, that's kind of where we start. Now, we definitely don't want to stop there and only look there. We need to always look at the three components of a healthy lifestyle: how we eat, how we think, and how we move. But if you think about a newborn infant, they're not really engaged in much of that at all. They're just brand new. The only thing they're doing is digesting and pooping. So they don't really have, aggressive thoughts or certainly bad behavior, not at that age. So really there's something more mechanically wrong with physical misalignment of the spine negatively affecting the nervous system. Again, that's what we call a subluxation. So in this office, we can track down those subluxations. We have specialized techniques that actually search for neurological stress on a spine, even an infant. The other day we did a 5-day-old, and we can do these diagnostic tests to fully understand the capacity of the individual, or certainly from day one. I want you to be encouraged. I want you to know that these ear infections that could lead to super complicated chronic ear infections 5, 6, 7, 8, 9, 10 times, tubes in your ear, and etc. So if we have repeated ear infections and our child's in a chronic pattern, what almost always happens? A dose of antibiotics, again and again. Now, you probably have heard, this has been on the news quite a bit, that this overuse of antibiotics is causing some very, very serious problems. And not only in our society, but also in our individual children. We don't want to set up our body with chronic antibiotic use because it just really wreaks havoc, especially on our gut. And if that happens, then that decreases our immunity. And if that happens, it decreases some of our potential in growing. So it's really a downward spiral to do antibiotics for an ear infection. I've had 35 years in practice. I've never really missed an ear infection. So they're really not hard to help. Not hard at all. I even have a story about a young girl named Sandler who had chronic ear infections. And, her mother just had little hope, if you will, on how chiropractic could help that. Her father had no idea about how it could help. But Sandler has been ear infection free since we started. And she had a very, very serious outburst for many years. So I want you to know there's a lot of hope. There's a lot of potential to take care of how your body works naturally. But on this one subject, it's just, I don't know, maybe it's just easy to keep doing what you're doing because, it does work. We get our children out of the ear infection, but a lot of times it's like cutting butter with a chainsaw. Yeah, it works. It's just a little overkill, and the consequences are serious. And the other consequence besides the antibiotic use is that we're not really getting to the cause. And when our children have challenges, especially in young age at birth, we never say that your child will grow out of this. Their symptoms might change, but technically they grow into this. So in a way, an ear infection is an opportunity to understand some neurological deficit on an area that controls literally the majority of your body. That's your brainstem at the very top. That controls everything from growth to procreation to digestion to heart, liver, kidney, spleen, your immune system, your hormones. I mean, like everything is in the upper neck. That's why we call it the upper cervical area. In the 1920s, it was nicknamed HIO, which stands for hole in one. Must have been a golfer in the group at the time. We don't want to miss the opportunity to make sure that we're at efficiency and as close to perfection as we possibly can. So in that light, an ear infection can be a good sign. It'll actually make us attentive to a need that we might have. So moms that have been up all night suffering with your children through the pain and through the anguish, they're going to get over this. And we also want you to know that it does help to know that there's a problem before it becomes something much more serious than just an ear infection. So if you enjoyed this video, if it's helpful, please share it. Please send it to your friends. I also want you to watch the video accompanying this by Dr. Tony Ebel out of Illinois, and you'll like his presentation on the same subject. You can also go to pxdocs.com for more articles on this exact subject. And also, if you're not in the Arvada area and you wanted to share this kind of information with somebody in a different area, they have a Find Your Doctor, PX Doctor, on that same website. So I'm Dr. Jim Rolls. Thank you for your time.